Welcome to the first 2021 edition of Chewing the Fat. We've had a bit of a break over the last few weeks, so I hope you're looking forward to some more great chats coming through from some of the people that advise to the Simpler Health team, and also with Dean and myself about what's happening with people on protocol, what's happening with myself, and some other great stuff we've got coming up. Normally we post these on Tuesday, Wednesdays, but this interview is too good to wait. So going to get this interview up now. It's between Dean and one of our expert advisors, Dr. Eric Hansen, who is Dean's personal chiropractor, as well as having a biohacking clinic that Dean and him speak more of in the clip. So kick back, enjoy. Any questions about this interview, this chat, send them through. If you'd like to find out any more about what Eric does in his clinic, shoot us through a message and we'll put you in contact. Happy New Year. Hope you're all safe, happy, and most importantly, healthy. Enjoy the clip.
Pleasure to introduce Eric Hansen, Dr. Eric Hansen, who's my personal chiropractor. And it's a real thrill for me to have this interview with you. It's not even an interview, mate. It's just a bit of a chat. First one for 2021.
2021, mate. Thanks for having me.
Yeah, and it's also great to have you as part of the Simpler Health clinical advisory team as well. And just to give everyone a bit of an insight as to who you are and what you do, I'll tell them who you are for me. You're the guy that fixes my neck and my back problems and keeps my shoulders functional. You got rid of all those angry, inflamed nerves in my left glute. You helped deal with some insomnia issues that I was dealing with. You shone some lasers straight into my brain. That was trippy. And you've got this really cool, I guess it's a neuro rehabilitation and somewhat of a biohacking clinic in Gladesville in Sydney. Yeah. So why don't you tell us a little bit about who you are, how'd you get to where you're at, what studies did you do, and what's the clinic that you've got in Gladesville?
It's an interesting story. So it started out like I walked into the wrong room at open day. So originally I was quite good with sciences through high school. So I originally was looking at doing a Bachelor of Science degree, and then turned up to the wrong room and sat through it. And it was only halfway through that they were talking about this weird cracking bones business that I tweaked that I was in the wrong room. But it stuck it out. I'm like, oh yeah, that sounds interesting. But then when I compared the Bachelor of Chiro degree to a Bachelor of Science, it's essentially the same thing. You go through all of the same biology and chemistry and physics and everything that you normally do. There's just this weird added bone cracky thing that you do on top of it. So I thought I'd give Chiro a go. And then that kind of, started me down this road of, instead of going heavy into the sciences, I started helping people instead. The other thing that sort of nudged me down this road, Dad was a very good boxer back in the day, and he almost went to the Olympics, except the week that he was going to go for the tryouts, he gave himself a disc injury. And then that always sort of left him with a chip on his shoulder, and he hung up his gloves, threw away all of his medals and trophies, and never fought again because he was so bummed out about it. And that always sort of stuck with me, that it was such a shame that there was no one really looking after him that could have easily said, look, let's get this under control quickly. You can still fight. Someone to, lay fears to rest. But, back then it's like, oh, you're just going to have to live with it. But, we know better now. So that sort of got me down the track of helping people. But pretty soon into my career as a chiropractor, you start to figure out that not everyone responds the same way. So you might get two people with identical migraines. One person responds immediately to neck adjustments, for instance, and then the other doesn't respond at all. And that sort of irritated me. I wanted to understand more about, why are some people responding better than others? And then, if you really want to understand the human body, you've got to look into the nervous system, and sort of biochem is on one of my things to study. But seeing as, I know you, I might just say you're in charge of the
Thanks,
biochem stuff, mate. I'll punt those patients over to you. But
I read a textbook once.
Yeah. But so the sort of started looking at different studying the nervous system and neurology. So I did a sort of a clinical neuroscience postgrad degree. So it's all about neuro rehab, and there's probably 20 to 30 of us in Australia who've gone through that degree. It is quite extensive and exhausting, which is why there's so few of us. But some people who have done that degree go into treating things like childhood disorders like autism, ADHD, ADD, those styles of issues. Other people start to specialize in different fields. I've chose to hang my hat on migraines, concussions, and vertigo and dizziness. They seem to be the ones that I really enjoy looking after. Because there's something nice about someone walking down the hallway or stumbling down the hallway, saying like the floor feels like it's moving. And then you do all of the assessments and you give people the answers that they haven't gotten anywhere else, and then you find the reasons for why they're feeling the dizziness or the lightheadedness or the migraines or whatever the case may be that they haven't got those answers anywhere else. And then you sort of break apart the brain and say, this is the areas of the brain we need to strengthen up. And then using the clinical research that's out there, there's plenty of studies on like stroke rehab, for instance, where they do mirror therapy to be quite effective for post-stroke, just getting the arms and legs moving the way they should again. So you take bits of research from all over the place and then roll it together to help these people get a better functioning nervous system. And then as the brain starts to get healthier, and then we're still doing their hands-on work to get their spine better, then the dizziness starts to go away and they're starting to get their life back. So I mean, you hear stories where people are just, it's taken over their life. They can't get out of bed. It's debilitating stuff, and you start to give people their life back, and it's a fun, rewarding job. So yeah, that's sort of my story and how I got here. And then I met you, and now I'm happy to say, okay, that's great. We got a whole nother set of things to fix, because I've studied the nervous system, don't know much about biochem or nutrition, so I'll punt that stuff over to you, mate.
Yeah, well, we met because I had a clinic not that far from yours. A couple of years ago, I'd set up a clinic called MSK Stem Cell Clinic, and you were interested in, well, how else could you better service your clients who are dealing with degenerative tissue disorders like osteoarthritis, and they've got all this joint pain, and there's only so much that you can provide them. And what I really respect and admire about you is that you're willing to come to the clinic and see me and sit down. And we just kind of talked about the gaps in our own offerings and services and the gaps in our own knowledge base and how we can complement each other and potentially work together. So I think it's a real opportunity for a lot of practitioners, if they're humble enough to open up their arms and their hearts to people with different types of expertise. And if everybody else is like that, then I think we've got a better chance in actually making a tangible, lasting difference to the things that people are dealing with that can't always be treated with drugs and surgery. And most of the time, drugs and surgery just isn't appropriate for a lot of these people.
Absolutely. And I think, we very similar mindset. And I think that's probably why we get along so well. But there is probably, there are practitioners out there who are certainly humble enough to go, you know what, I've taken this as far as I don't know what we're doing now. This is outside my expertise. We need to do something different. But there are also plenty out there who are just keeping doing the same exact thing time in and time out. And then, 6 months go past, 9 months go past, a year goes past, and then that person's symptoms that have been taking over their life haven't changed at all. And that practitioner really, there's just wasted thousands of dollars and a year of that patient's life. And it's all because, they just either didn't know because they weren't willing to pick up a textbook and read outside their scope of what they know, or to ask for help. So, you got to know your limitations. And I'm certainly aware that, there's some things that I'm good with and there's some things that I'm not great with. But yeah, you have to find that network of people that you can trust to say, look, go talk to Dean. He's phenomenal with his stuff. And then Dean knows a network of other people who are also great in different areas. But once you're exposed to a network like that, where everyone's goal is, let's get this person as healthy as we can get it. It's not a money-making factory where I'm going to string this person along for a good 12 months just to try and get the Porsche paid off. So yeah, it's really happy to be part of this network of people you've put together, mate.
Yeah, well, I seem to be drawn to experts who have expertise in brain health and brain function from, yourself, which is great that you're just up the road and, I can call you, I can come in and get treated and so forth. And whenever I do, we always have a bit of a scientific kind of banter as well. But then I've got Kristen Willamere, she's got a new book that's just been published called Biohacking Your Brain.
Oh, cool. All right, I'll pick it
Yeah, I've asked her for a signed copy and she's like, oh my God, of course, I'll send you one.
up.
And then,
Awesome.
my patron mentor is Professor Joseph Maroon, who's a world leading neurosurgeon in Pittsburgh. And he's a sports medicine physician as well and team neurosurgeon for the Pittsburgh Steelers. So I'm kind of drawn to that, and it's still somewhat of an enigma, brain health and brain function, and it's just fascinating. But everything, I mean, if you focus on cognitive health, and more importantly, well, increasingly, we're learning, it's still in its infancy, gut health and the gut microbiome, and that interplay seems to take care of pretty much everything else, right?
Yeah, and that's so it's like some of the more complicated neurologists. So the issue with specialization is you get people who are the best people in the world for treating concussions from a endocrine point of view, or there might be people that are where the best at treating gut, but it's so specialized and so sort of one directional that there's no sort of broad scope of approach. So they've got one trick that works perfectly on 5% of cases, but there's still a huge amount of people who are going to miss out. So if you happen to have a concussion that disrupts your hormonal system, then great, that guy that's the endocrine rebalancing guru is going to be perfect for you. But if it doesn't affect that part of your brain and you still got post-concussion symptoms, it's not going to work. But you're right, that sort of gut-brain interplay is affected with so many conditions that it's a really good foundational area to improve. And then off the back of that, if there are still symptoms to correct, significantly easier to get results with whatever that extra therapy may be once you've corrected that brain gut connection. Because if your gut's on fire, then good luck trying to get rid of your brain fog. You really have to treat both of those if you want to try and get your brain at all healthy. But yeah, the research does look like it's exploding in that field and developing in a really exciting way. So like 5-10 years from now, I think the stuff that is going to be available for treating the brain connection is going to be huge. And the amount of sort of conditions that they're now finding that brain connection breaking down as being involved is increasing. So yeah, and as the awareness increases, then you and I are going to get busier and busier.
Yeah, I think so. I mean, it's funny. I put a post on Facebook today actually, and someone commented, that's a complex way to say calorie deficit. Sharing the results of one of my clients who's lost 35 kilograms. It's about 30% of her total starting body mass, right? Which is extraordinary because even with bariatric surgery, you would only expect on average about a 23% loss of total body mass. And she's achieved 30%, and it's been linear. And what it takes, just dealing with a human being, coaching them to stay on that downward trajectory over a long period of time, 28 weeks. So it's an average of 1.27 kilogram loss per week for a female, which is amazing without strenuous exercise. And that gets simplified in some people's view as she just ate less. I mean, it's so much more complicated than that. You got to handle the fundamental biochemical cause of the weight gain in the first place, which is the hyperinsulinemia and the insulin resistance, obviously, if someone's been obese for most of their life, they haven't got the best gut microbiome. So that needs to be handled and reconstituted. Their brain function is different. Their posture, their breathing. I mean, all these types of things. So let's jump into this because, you know, I deal with clients, they lose weight and we take before and after photos, right? In fact, I get them to send me updated photos every 4 weeks. And there's a method to that kind of approach as well. And it's all in service of the client because they need to see for themselves the reality of the progress that they're making. But what I consistently see with the side-on view is their posture improves. And I don't really coach them on anything. Now, I've got my own theories, but let's hear it from you. What's actually happening there? Because I see that their shoulders come back, their head comes back. It's like their chest comes out. And I'm not getting them to do any sort of postural strengthening exercises. I'd love for them to do it, but I don't, you know, prescribe anything. What's happening there?
Posture is an interesting one. Originally, one of my main focuses before I started to go down the treating concussions and dizziness rabbit hole was improving people's posture. And to a degree, it's still one of my main things that I focus on with the aches and pains side of my practice. But posture has impacts from a whole bunch of different areas of the brain. So one possibility with your patient could be purely confidence. So your emotional tone has an impact on it. So if you just think about it, like if you're depressed, it's been a long day, oh, I'm just knackered, like you're naturally going to slouch, slump, you're going to frown more. There's all sorts of musculoskeletal impacts from your emotional tone. Whereas, you know, go watch a comedy movie, have a laugh, share a beer with some mates, you watch how much taller you stand up. So emotional tone or however you're feeling in that moment will have an impact. So, I mean, if I lost 20 kilos, I'd be standing pretty tall.
Yes.
Well,
you see it in the Facebook photos. It's like, it's really difficult to find a before photo because they hide out. They're at the back of the crowd, that they only take headshots, and, you know, because they're not proud of their body, etc. So I completely get it. And I think, you know, some of these, like Anthony Robbins advocates, like even that you change your posture, your physiology. It's pretty, when you're standing tall with your chest out, it's pretty difficult to feel down about anything in that moment. So okay. What else?
There's a few interesting papers on that where they've measured sort of, you know, your electrodes on your brain to measure your sort of quote unquote happiness and depression levels, and said, okay, smile for 5 minutes, and then you know, you're not happy, but just that act of activating the muscles around your face, your brain recognizes that, oh, I'm smiling, I must be happy, so I'll be happy. And then you do the same thing. You frown for 5 minutes, and your brain goes, oh, the muscles that I activate when I'm grumpy are activating. I must be grumpy. Let's be grumpy. So the way that you can sort of hack your brain that way. Like if you want to feel better, all right, smile, 5 minutes.
Yes,
that'll do it. But I'm getting back to your patient. So I mean, potentially it's a confidence thing. Like they're just feeling better about themselves. The other possibility there, because you mentioned before that, like the hyperlipidemia. So with any gut-brain axis breakdown, inflammation is going to be a result. So you're going to get inflammation circulating around the guts. You could get inflammation breaking down the blood-brain barrier and starting to affect brain. There's an area of your nervous system right at the top of your brainstem where all of your flight-fight reflexes live. So your sympathetic nervous system is in charge of your flight fights. That area of your brain's your mesencephalon. It's heavily populated with receptors for inflammation. So if you've got inflammatory cytokines running around your body, it's going to activate the flight-fight reflexes in your brain, and then that's going to activate all of your sort of immune system responses to go out and kill things. It's going to start to curl you into a ball and get away from the predator. So all of your flexor muscle tone, so your pecs are going to tighten up. You're going to drop your head down, curl into a ball, pretty much try and get into the fetal position. So as you increase the activity of that flight fight, it's either curl into the fetal position to you know, get away from the tiger, or, you know, get ready to fight someone, in which case you're hunching up into a ball to do that. Whereas as you start to break that, get rid of the inflammation and heal the gut-brain axis, as the inflammation starts to lessen, you're no longer going to be activating that sympathetic nervous system as much. So you'd expect that there be a change in the balance between flexor tone and extensor tone. The other thing that's going to happen is, if you're in that flight, fight, reflex mode, a lot of your executive functions, so your cognitive thinking, your lateral thinking, all of the things that make us smart and human, start to shut down. So it's more important to survive the fight with a tiger than it is to plot and plan and think about all of the big things that you're going to do in 2021. So that sort of higher order.
If I can just interrupt there, it's so pertinent, because, you know, people think just I do weight loss. No, what I do is I work with people to cause breakthroughs in participating in life. Health is a function of that. So, but it's hard to get up for the game. It's hard to kind of, even when you know what you got to do, even to get yourself to do it, because if you've got the brain fog and the lethargy, and you just can't, especially for men post 40.
That's a textbook example of what we were talking about before, where calorie deficit, some people are going to lose weight that way, but it's a unidirectional, one-faceted approach to a problem that's going to help 10-20% of people maybe. But the vast majority, like if you've got a gut-brain breakdown, inflammatory cytokines, hyperlipidemia, calorie deficit's not going to work.
No,
it's too simple approach to a far too complicated. So that's you've got to know, say, look, I tried calorie deficit, it didn't work. Okay, why didn't it work? You know, you've got to know, okay, I'm a nutritionist or I'm a dietitian or whatever. We did the stock standard approach. Okay, it didn't work. We need to figure out why. It's not just, okay, maybe cut out more calories. Let's see if that works. So you've got to, you know, okay, no wonder you've had trouble losing weight, because you've got this problem, this problem, this problem, this problem. It's not just your fat. You've got 16 little biomechanical, metabolic issues going on that we need to mop up, as well as a breakdown in your gut-brain axis. So like you can't approach these things from again, it'll work with 10% of people.
Yeah, exactly. I mean, you could just eat, I don't know, 800 calories worth of ice cream. That's not going to get you healthy. It's not going to leave you with a sense of vitality, and it's certainly not going to restore biochemical function, rebalancing hormones, restoring metabolic health, neuronal function, cognitive prowess, ability to sleep. Oh my God. So one of the things that I noticed with my diet is, especially it's a very sort of, like you said, simple way of explaining things, but you lose the fat around your neck, right? There's not as much weight on your tongue when you're lying down, trying to sleep at night. You don't get as much airway obstruction. Now, if your brain's not getting enough oxygen, then your central nervous system is going to alter your structure, right, to improve airflow. And how does it do that? Brings the head forward and like this, right?
Yep.
Causes neck pain, and that will contribute to headaches.
Absolutely. Yeah. Headaches, migraines, there's a lot of things that can go wrong if those top few joints in your neck start to get locked up and jammed up, which will happen when you start to get that accentuated forward head carriage to help you to breathe a little bit more. But as soon as I hear sleep problems, you can easily double the amount of time it's going to take someone to get better. Sleep is so important for brain health. It's a no-go. So if someone comes in like, 4 hours a day, 4 hours a night is what I'm getting. It's like, we've got to fix your sleep before we've got even a hope in hell of trying to get your brain fog under control. So like anything that reduces that, like even if it's just fat mass around your neck that's obstructing your airways and making it difficult for you to sleep, we have to get that under control, because the long-term consequences on your health of poor sleep, it's not good.
I mean, these things don't help, you know.
No.
The people, and it's not just the blue light messing with the chemistry and the melatonin, etc. you've got, so one of the things for people to understand, for you to sleep, you've got to feel safe. And if you're looking at social media on your phone when you're in bed, just minutes before you're trying to fall asleep, you've got the world's problems coming at you through this tiny little device that your brain, it's so threatening to our biology. It's like, how can people sleep?
Yeah, and that's where for my patients who do have sleep issues, it's like, okay, as soon as the sun goes down, no devices. Like it just has to be a rule. Like you cannot look at your phone as soon as the sun goes down. Like it's hard to do for sure. And like I catch myself still on the phone, but if you've got sleep as an issue, as soon as that sun goes down, you've got to try and limit your light sources as much as possible.
So if it's a problem, you really do have to be unreasonable in that intervention. You just have to. I mean, what else are you going to do? Just keep living off 4 hours sleep a night? That's just not workable. And people think, oh no, I can get by. Listen, you're not in relationship with you. You're not your partner who has to live with you. You're not your kids who have to deal with your grumpy attitude nonstop, or work colleagues that are too afraid to talk to you now. It's like, people have to step outside it, but you can't. Here's the problem though. You can't even expand your view of your life when you're that sleep deprived. You're just surviving.
But that's, you do get that pushback where people's like, well, why do I have to drop the phone when my partner's on the phone? And it's like, well, your brain is sensitized to it. So you've got to go above and beyond to limit your light sources until your brain is healthy. It's the same as, should I go out and eat a burger? It's like, well, you're 50 kilos overweight, so probably not. When you're at your ideal weight, yeah, sure, have your burger. I mean, you're going to pay for it in a little bit, but it's not as bad for you when you're healthy than when you're unhealthy. So same thing. If you've got an unhealthy brain and you can't sleep, you've got to really go above and beyond and make the effort to get your brain under control. And then when you're sleeping well, yeah, sure, play on your phone. But until then.
So there's all these issues, right? From gut health to metabolic health, hormonal imbalances, brain dysfunction, structural problems, from here all the way down, right? There's gait problems. I sprained my ankle when I was 10 years of age, and it just caused lots of issues all through my body as I got older. I found out in 2008 that my core muscles weren't firing synergistically, and I'm like, how come? What went wrong with me? And they're telling me, I'm like reading stuff about when you're a baby or something, you're learning how to roll over and crawl. And I'm like, did I not learn how to crawl?
Yeah. The primitive reflexes are pretty interesting stuff once you start to look at them.
Yeah. So where do people start? Obviously, they can come to your clinic in Gladesville.
Well, I mean, that's certainly an option. I think a big part of it is just getting exposed to your network. So you've got to find someone who knows enough about the network and enough about the problems out there to go, okay, so you've got back pain, you've also got, you're overweight and you're not sleeping well and you've had a concussion. All right, so I know Eric's good with back pain, he's good with concussions, but you're better with insomnia and better with weight loss than I am. So it's about making a list of, okay, these are all of the things that I would like to get fixed. And then looking at that list and then, okay, who's the best people or best person for this list? And it is probably going to be a team of people working with you. And it might be that, my back pain is the biggest priority for me at the moment, in which case, okay, let's get your back pain under control. Now you're feeling better. All right, let's get the weight under control. Go and see Dean. And then, insomnia and the concussion symptoms are problematic. All right, back over to Eric. So it really is about figuring out what you want to get better, and then talking to someone like you or someone like me who's got a network of people to know, okay, this is the best person for you for these sorts of symptoms, and this is the best way that we triage your goals to getting healthier. But so, I mean, it's easy enough to get in touch with me.
Well, what I love about your approach is there's this functional context. So it's all about performance, and you've got some cool technology in there. So just to share with everyone, I come in and I've got these angry nerves in my left glute, and I hated it. It was like my leg when I was driving the car. I just wanted to rip it off. It was so uncomfortable. I didn't know where to put that leg, and there was pain in my hip, and then you had this approach to not only deal with those angry nerves and kind of, get my body biomechanics working properly, but then getting this thing to activate my glutes appropriately, and had all these trippy, like, this is how it was for me, dude. I'm doing these clams with like elastic stuff around my knees and lifting my legs, and then at the same time listening to two different podcasts, trying to focus on one, not the other, and then following some patterns on an iPad screen, and at the same time your colleagues got a laser in my head. I mean, this is full on.
You were a fun one. We had to pull out every tool in the toolbox to look after you.
I was demanding a lot from you.
Yeah, for those of you listening at home, when Dean came in, we did a QEEG scan, which looks like it's out of a sci-fi movie where this funky cap electrodes are going everywhere. But essentially what we're doing is we're measuring brainwave activity in different areas of the brain. So we wanted to know is there low functioning in some areas, too much activity in some areas. But once we mapped out the abnormal functioning areas of Dean's brain, we could figure out the best way to restore balance. So it's really not that complicated. If something's running too fast, you got to slow it down. If something's too slow, you got to speed it up. So for Dean, we found you had some issues with language processing or processing speech. So one of the ways that we challenged your brain was to say, okay, let's work on your speech attention. And that's where we gave you music in one ear and podcast in the other, and you had to listen to one and not the other. So it's finding your weaknesses and then giving you an exercise that uses that area of the brain, but at a rate or a level that you can tolerate. So if I push you really hard, you're going to get a migraine, you're going to feel horrible the next day. But it's about, okay, this is your weakness, this is what we've got to do to get it better. But so yeah, the QEEG scan gave us an idea of your hot spots and your cold spots.
I'll tell you what was really cool about that, and getting all that data back, and firstly, just actually having evidence that I do in fact have a brain. I mean, that's like enlightening in and of itself. And you kind of go, oh, wow, it is there. And then there's all these hypoactive and hyperactive regions in my brain. And I was able to identify, oh yeah, I remember that knock. And, I've got this scar on my head from when I had a fall. And, or that was when I got knocked out on the soccer field when I was 18, 19 years of age. And, all these things, that never goes away. It's all there. There's like a record of your entire past, all in the activity levels of your brain. And there were some regions that were like more than 3 standard deviations from the norm. And I remember standing there like looking at you going, how do I even function? And clearly there's compensatory pathways that make up for it.
The brain is an amazing adapter. So when it loses function in one area, it learns a different way of doing the same tasks. But every time your brain compensates and learns a new way of doing something, it's less efficient. So ideally, we want to restore as many of those areas to normal function so that your brain is as efficient as possible. But that's where you get some scans coming in. It's like, I'm talking to you, but is this going in? And it really is fascinating what people can to outward appearance normal, but once you have
a scan, especially like chronic pain. There was a region there you pointed out to me that was due to the chronic back pain that I'd experienced in the past. And so when you've got this information overload, so there's pain coming from a certain region in your body, and you get the signal going to your spinothalamic tract up into your brain where it gets interpreted as pain. That's a lot of information for the brain to constantly have to process, which takes energy. So if it dampens down the activity of that region of the brain, is that right? So then it doesn't waste as much energy.
Your brain will actively, constantly try and protect you. So whether that's like a traumatic emotional event in your past, your brain's going to avoid thinking about it. Same thing happens with pain. If you've got sort of chronic regional pain syndrome or a dodgy ankle, if we look at the sensory map in your brain, so we've all got this sort of map of your brain where if you wriggle your right pinky, there's an area in your brain that's going to light up because that's the area in your brain involved with sensation from
Everyone's
your
wriggling
right.
their pinky now.
I was just doing it, but chronic pain warps that map. So the map becomes less well defined and less accurate, and then your brain starts to actively shut it down because it doesn't want to think about the chronic pain that it's in. And that's the setup for sort of chronic pain. So in some instances, chronic pain is a peripheral issue where we might have a dodgy knee, and it's just a dodgy knee. You need stem cells or you need some surgery. But in some instances as well, the chronic pain is because the brain is no longer as efficient as it should be, and the area of the brain responsible for mapping out your knee, for instance, could be so vague that your brain is interpreting it as being chronic pain. So that's where your brain is producing the sensation of pain, whereas the biomechanical issues in your knee have been healed. There's nothing wrong with your knee, but it's all brain driven. Usually it's, in my experience, there's a mix. There's always something going on locally as well as in the brain. But with chronic pain, you have to treat both for sure. And then getting back on track with, so with your scan, when we found that there were some areas of your brain, like with chronic pain or attention, the other ones escape me at the moment, but there was a few with you that we found that were a little bit slow.
Like there were parts of my brain I couldn't switch off. And I was just, that's what kept me up at night. And I'm constantly thinking and creating and planning, and I just couldn't switch it off. So
yeah, no off button. But we used sort of, so those targeted exercises, if you like, where we had you focusing on one podcast but not the other. But over the top of that, we used transcranial laser therapy. So that's where a class 4 laser over your scalp, and then the red light goes through your scalp to the area of your brain that we're trying to increase the metabolic rate of. The light in the laser speeds up your metabolic rate in those areas, and so your brain starts to have more energy available to do things, and the networks start to get stronger in that area. And this isn't witchcraft and voodoo. It sounds witchcraft and voodoo, but there's hundreds and hundreds of studies showing the effects of transcranial laser therapy. It's a really exciting field. That's just
this whole field of photobiomodulation, and some people might already be familiar with infrared saunas and beds and devices that you can stand in, but you've got a very targeted, very specific approach where you use a laser. You can hit a certain region at a certain depth, and you can alter the frequency. I mean, it's just brilliant, the approach that you have. It's just so precise, and you are able to activate the mitochondrial function in those neurons, in those areas of my brain to restore normal activity. So my brain could actually work its own stuff out. I mean, it was great. I started sleeping again. I didn't have obviously the musculoskeletal issues. I still don't have much of a backside, mate. I've got to do some more work on building up those muscles.
Got to get the booty working.
Sorry?
Got to get your booty back to work.
Exactly. But that'll make, is obviously going to make a difference for more functional stuff, because, I've taken up martial arts.
I saw that too.
Yeah. And now you're a bit of a, what do? You do some sort of martial arts, don't you?
I did karate for a good 20 years before work took over. And then more recently, last 2-3 years, I've been doing Brazilian Jiu-Jitsu, which is a lot of fun. But, if you're worried about personal space, Brazilian Jiu-Jitsu is not for you. But that's sort of, that's my meditation. It's hard to worry about the world when someone's trying to choke you. So it's focusing on the now pretty effectively.
Yeah. Does your expertise in human anatomy kind of help?
I'd like to say yes, but really, no, I'm not that good. It certainly does when I'm putting back together the person that I just broke, though.
Now, mate, I've stolen you away from your patients today, but I do want to just talk about a couple of things that you've got at your clinic, which I just think is really, really cool. So you've
Yeah,
got
yeah, cool.
this laser, but you've also got a hyperbaric chamber. Tell us about that.
Yeah, so the hyperbaric oxygen chamber is another good one. So again, with each of these things, in isolation, the laser therapy is really effective at activating your brain. But when you use it in concert with other things, then the effects are amplified. So that's where laser therapy plus some pretty specific brain activating exercises is really effective. But once we run you through hyperbaric oxygen chamber therapy, so it's you lie in this tank, it's pressurized, and then we pump in air that's got a higher oxygen content to it. What we're trying to do is we're squeezing oxygen through your skin directly into your body via your skin. So it's not going through your respiratory system. Well, it is, but most of the impact is directly through your skin. So we're trying to super saturate your plasma with as much oxygen as your body can possibly carry. There's some really cool research being done with hyperbaric oxygen chamber therapy and stroke, but also with things like Parkinson's. So increasing the oxygen content in your body is helping the areas of your brain that might be shutting down with stroke to stay healthy and stay active, or to reactivate. So with stroke, one of the big issues is like you might lose an area of your brain that's dead because it was lost with the stroke, but there's usually a surrounding area around the dead zone that loses a degree of function. And that's largely because of the low oxygen being carried into that area. So when we supersaturate the plasma with oxygen, that zone starts to reactivate and get back to normal 100% function, rather than living in a state of low oxygen and start to slowly wear out and lose function over time.
Yeah, very useful, very useful tool in the context of regenerative medicine,
Absolutely.
and helping to support our body's own natural regenerative processes, the activation of these, healing cells, these stem cells that we all have in our tissues, and allows the tissue to remodel appropriately. So yeah, very, very useful tool. And then you've also got a cryosauna. Or
Yep.
what's the correct
That's
term?
my
Cryo tank, cryosauna? What's the?
Cryosauna. But yeah, that's my new favorite toy that I've had for a year and a
I'm
bit
yet
now.
to try it out. I've got to come and jump in it.
The first time's it's not as bad as you think, but we are sitting you in 3 minutes of very, very cold temperature. But the cold shock, when we were talking before about the sympathetic nervous system being overly active, so good luck finding someone in modern life that doesn't have a sympathetic dominant lifestyle. Everyone's too stressed, and it's starting to affect everyone's health to a degree. When you're exposed to intense cold like that, your parasympathetic nervous system has to activate to pull your blood away from your periphery, and it shunts all of that blood towards your guts and towards your brain. So really good for healing guts and really good for healing the brain. But as you activate that parasympathetic nervous system to that degree, it helps to switch off some of those overactive flight-fight reflexes. So I'm finding some good success, and there's some papers to support this on the cryosauna for insomnia. But it's also really effective for chronic inflammatory issues. So whether it's mold sensitivity, and people have got all sorts of inflammatory issues from mold, or I've got a fellow coming in for Lyme disease at the moment. There's also some good results on it for orthostatic hypertension, or POTS. So if people stand up too quick and they get lightheaded and that persists for longer than it should, really effective for that. So it's really helpful for a host of issues. There's a lot of big football league stuff in the States, and professional fighters usually have one of these at home, and it's a regular part of their weekly routine, because the cold exposure also activates a whole bunch of anti-inflammatory cytokines. So you get a anti-inflammatory response that lasts up to 6 weeks, but starts to wear off after that. But really, really helpful for getting rid of those little niggles that are either just chronic arthritis, or you've trained too hard and you've hurt yourself, and you've got to get that inflammation under control so you can go back and train some more. And then fighters are using it quite a lot immediately after a fight if they suspect they're getting a concussion, so that anti-inflammatory chemicals from the cold exposure to help calm down any brain inflammation that they might have from a knock or two. Is some really cool stuff, if you pardon the pun.
Yeah. But we'll be able to supercharge it, right? So imagine if you're doing it in a context of an interventional nutritional approach. Say if I put someone into a very high degree of ketosis. So we're doing the cold therapy in the context of nutritional ketosis and caloric deficit. Like I bring calories right down. You have to bring it down to like 800 calories to get the sort of genetic changes, especially in our fat tissue, that are more conducive towards longevity. So if we did it in that context, I think this is what I love about you, is this multimodal approach. As you said right back in the beginning, it's never just one thing. And I think, I don't know, maybe correct me if I'm wrong here and speaking out of school, but I think that may have been somewhat of a detriment to the practice of chiropractic for a lot of practitioners, as they were arrogant in thinking that, just manipulating the spine was the answer to everything. Do you have a view on that, or is that not cool for me to ask?
I wouldn't say it's just chiros. We're certainly guilty of it. But like physios do it as well, chiros do it as well, GPs do it as well. Like
GPs just want to drug you, and surgeons just want to cut you, and it's So it's
finding the person you trust, or finding someone who is humble enough to say, I don't know. But I'll do the research, or I don't know, I'll put you in front of someone who does know. So whether that's a chiro or a physio or a GP or anyone, you got to find that person who's right for you and is willing to say, you know what, I can't help you anymore. You need to see someone else. And that's where so you're talking about sort of cryosauna. Like if the goal there is fat loss. So yeah, cryosauna therapy, it will burn off between 500 to 800 calories while you're in there for that 3 minutes. It also helps the conversion of white fat into brown fat, so the good fat. But if you're doing that on top of your ketosis work and all of the nutritional approaches that you're using, then yeah, for sure, you're going to get a much faster result. So yeah, again, it's not just 1 + 1 = 2. It's my approach plus your approach equals 4. Like it's faster.
Yeah, that's brilliant, mate. We've discussed heaps. We'll get you on another one of these. We'll do these, relatively regularly. I know everyone's so busy, so really appreciate your time and look forward to speaking again. I've got a book in to come in for a treatment. Going through the Christmas period, I haven't seen you for a little while, and I'm like, I need your magical hands on me.
Well, we can make that happen, mate. Thanks for having me on. It's been a pleasure talking to you.
Yeah, good stuff, mate. Appreciate it.